In a world where everyday activities are intertwined in the cloud, going to a cloud clinic for healthcare needs could be modern and efficient.
And all the tools in a doctor's office are connected and live streaming to the doctor remotely. What that allows you to do is not only do you get access to primary care, but you get access to 70 specialists same day.
This was Dr. Danish Nagda's idea. He calls it Rezilient Health.
We have clinics in Dallas and in Oklahoma. In St. Louis, we have 2.
The St. Louis startup combines telehealth from home with appointments at a cloud clinic, like this one in Clayton. Doctors are live streaming into the room. Medics use different scopes, probes, and other tools. Doctors are getting the measurements and information in real time. He's offering a resilient health plan that sustainably builds between the patient and doctors over time in a way that is transparent and efficient. Nagda is the founder and CEO of Rezilient.
Rezilient helps employers reduce healthcare costs by providing same-day access to primary and specialty care. So you come into a clinic, you get access to care, and you go home. So the way that we approach this is virtual care when appropriate, in-person care when appropriate.
The streamlined system gets results with a diagnosis and more timely treatment.
Can we take a look at her left ear?
Nagda says Rezilient members get easy access to preventative care, avoiding costly trips to ERs and urgent cares.
I'm a physician by training, trained at Penn and WashU, and I'm an ear, nose, throat surgeon.
Having both preventative and more affordable care is a big motivator for Dr. Nagda, along with the loving memory of his father.
I was a caregiver for my father. My dad came to this country, no formal education, worked really, really hard. All 3 kids went to the best schools in the country, the American dream for immigrants. But unfortunately for Dad, even though he had access to health insurance, he didn't have good access to health care. Ended up having his first heart attack at 53. While I was in residency, when he was 60 years old, I actually moved him into my own home and took care of him during residency as a surgeon, and took care of him for nearly a decade. That experience of being both a doctor and a caregiver is what inspired me to build this.
His experience is shaping Rezilient Health.
Not only did the healthcare system and the lack of access from it and his misdiagnosis, which is actually what was the cause of all of this, they missed that he had sleep apnea for 20 years. All he knew was a CPAP, and my dad would be here to play with my kid. The fact that they missed all of that, not only did he lose everything and our family lose everything, but his employer lost millions of dollars. Nobody won except the system. The system won. They don't actually mention sleep apnea. On his death certificate, did not say that. But that was the cause. That was the root cause of the disease. The system is designed that way. They want opacity. They don't want transparency.
That's a selling point to businesses, and his story is the basis of the business model.
Every year, employers are seeing increases of 20-30% in their costs. And they're saying, we're done. We want a different system. And the answer to that is very straightforward. It's more time with your primary. Remember how that used to be the way things were? Now, you get 3 minutes and they kick you out. And it's because of this underlying thing called fee for service. So they get paid more the more patients they see. And we actually get paid for value. So we actually get paid to take care of a whole patient. So that's the business model change. And we've convinced employers, hey, let us have more time. Let's give them incredible access, not just to primary care, but to specialty care. And surprise, people started losing weight. They started getting healthier. We started changing the course of people's lives. We've hit a nerve. We've hit a chord.
Investors are paying attention. Rezilient Health has recently raised $10 million from investors that include St. Louis billionaire Jim McKelvey, a serial entrepreneur and inventor, co-founder of Block, formerly known as Square. Among Block products, Cash App is one that's widely known and used.
So we wanted to raise from people that were mission aligned, that believed that healthcare needs a bigger change, and every major investor that came in has actually built $1 billion company, which is very unusual.
And now Rezilient is looking forward to some big things happening.
We are expanding in St. Louis, and we'll probably have 5 to 10 clinics in St. Louis in the next couple of years.